a fellowship and I did residency in OBGYN. So I am an OBGYN that delivers babies and stuff. And then I decided to specialize in the field of infertility. I come from a dad and two brothers that also graduated from Woodward that are urologists. So I was very interested in the reproductive field. And I grew up thinking like family is the most important thing. So I was super interested in this field. I love babies and psychology, and there's a lot of that in this. So I love helping people get pregnant and talk about their paths to fertility and all the different ways that they can achieve the family that they would like. Personally, I am also 36 now, and I'm not married. And I have frozen my eggs 4 times, thankfully. So I'm excited to share with you guys my story, and hopefully, I was lucky that I knew about this, starting at 28 when I started freezing my eggs. And I just want everyone to know at an earlier age so that they can do that too. Cause I know that I was lucky we were in the medical field and I had that opportunity. So I'm excited to share all of that with you guys.
Yeah, so I am Jessica Shantha. I also graduated with Caroline and Valerie, and I'm super excited to be here today. And I want to say a special thanks to Caroline for giving us this platform, and for all of you guys, who are attending and joining us today. I know a lot of you guys are our friends, and so and family, and so just special thanks to your support and to everyone else who's here really to learn a little bit more about women's health. So I, like Valerie, I went to University of Georgia. I went to Morehouse School of Medicine, and then went to Emory for ophthalmology residency. I completed 2 fellowships. I left, I went to San Francisco and Hawaii, and then I came back to Emory, and I have been faculty there for 4 years at the Eye Center and practice ophthalmology. And I honestly didn't think about fertility preservation much. It definitely was a thought in the back of my head because I didn't get engaged till I was 34. And I'm still not married now. So it's something I've thought about a lot. But it really became a serious consideration when I was diagnosed with breast cancer at the age of 34. And so this was a really unexpected diagnosis. I did not have a family history. I really, wasn't at high risk for developing this disease. And it's extremely uncommon in younger patients. And so when I met initially with my oncologist, she asked me about my family planning and if I had children. And unfortunately, at 34, I hadn't had children. And so it was a consideration as we figured out what my treatment plan was going to be, what chemotherapy I was going to have, what surgery I was going to have. And so she immediately said that this is, something you need to consider because of the chemotherapy. It could be potentially cytotoxic, which could cause me to be infertile. So if I wanted to have children, she would give me the couple of weeks that it would take to freeze my eggs. And then I decided with my fiance to freeze my embryos. So I'm excited to share a little bit more about this with you all today. Just a reminder, we're going to ask each other questions, interview style. If you guys have questions, please type them into the chat. Caroline will interject, and we'll definitely have time at the end of this to talk more about your questions. So Valerie, you mentioned that you started this at a young age. Like I said, I wish I would have done this when I was younger. So what was sort of your motivation? Because in medical school, we didn't really talk that much about reproductive, endocrinology and fertility preservation. So kind of what got you started early on in terms of thinking about this?
Yeah. I just remember that I think I may have forgotten to say that I'm also a fertility doctor now. So I did go to residency for OBGYN, but then I went to a fellowship in fertility, and now I'm a fertility doctor in Atlanta at Shady Grove Fertility. Okay, so your question was, what got me interested in freezing my eggs? So I did start at a very early age at 28, and for that time, I was one of the only people I knew that had heard of freezing their eggs and was participating in that at that age. So egg freezing has sort of, become more and more popular in the last 10 to 15 years. So I'm sure you guys have now heard of it. And at the time no one had heard of it really. And I found out about it because when I was in medical school, I fell in love with the field of infertility and knew that that was the path I wanted to do. And, I've always really been focused on, when I'm going to get married, when I'm going to have kids and whatever. And obviously now I'm 36 and don't have that, but I knew that that was super important to me. And I knew that I had a long career ahead of me and I wasn't married at the time. I also knew that my mother had menopause relatively early. She had it at 43. And I knew that that was sort of early. And now that I actually know things, 51 is the average age of menopause in the United States. So under 40 is considered premature ovarian failure, and 43 was low. It was certainly you know, not crazy for me to explore my fertility. So as you guys know, as we get older, we have fewer and fewer eggs. So inside of our ovaries, we have two ovaries, and inside of our ovaries, we have these little follicles that are sacs that hold our eggs. There should be an egg in each follicle. When we were inside of our mom's belly, when she was 20 weeks pregnant with us, we had all the eggs that we're ever going to have. We had 6 million eggs. By the time we were born, we only had 1 million. By the time we had our first period, we only had 400,000. And by the time that we hit menopause, we'll have about 1,000 left. So every day since we were inside of our mom's belly growing, we lose 20 to 30 eggs a day. They just die, get reabsorbed by our body, and we can never use them again. It's like really depressing. So I did learn that also in medical school. And so I knew that as you got older, you have fewer and fewer eggs. And again, I was 28, had this long career ahead of me, and was not married at the time yet. So I knew that I wanted to, first of all, be proactive and just assess inside of my body what age it was. So even though I'm 36 right now, inside of my body, my ovaries could look like they're 26-year-old ovaries, or they could look like they're 46-year-old. You don't really know that until you go see a doctor and they assess 3 things. 2 things are blood tests, the AMH and the FSH level, and the other is the ultrasound that looks at the number of follicles you have. And with those 3 numbers together, we can kind of assess how close you are to menopause. And based on that, you can at least have more of an educated, you can at least be more knowledgeable about your own health and where you are, and make a decision, with your doctor or with your family based on, when you want to freeze your eggs and what your path is like. So for me, I knew when I got my results back, they were slightly low. And I just had this feeling that I was going to be 36 and not married. So I'm really happy that I did freeze my eggs. And I had to do it 4 times. And
why did you do it 4 times?
Yeah.
Specifically, because I feel like, I only did the procedure once because I only had 2 weeks to do it. But on average, because you're a fertility specialist, like how many times do your patients actually do this sort of egg retrieval procedure, and why did you do it 4 times?
Yeah. So, egg freezing is not, it's not cheap, it's not as expensive as IVF is, but it's certainly not, it's a big investment. And at 28, I certainly didn't have that money, but, I did it. So I did it the first time, and I knew that for me, I wanted 2 to 3 children.
Okay.
Really I wanted 4, but now it's down to 2 to 3. But anyway, so I know that, the more eggs that you have, the more frozen, the more likely they are going to lead to more and more children, obviously. But if you have 3 eggs frozen, that doesn't mean you're going to have 3 babies. What happens is you freeze, 10, 30-year-old eggs, for example. You then are ready to use them when you're 40 or 35 or whatever. So you have to thaw the eggs. Not all the eggs are going to survive the thaw. Then you have to fertilize the eggs with your partner's sperm or donor sperm. Not all of them are going to fertilize. They become embryos, and they have to grow out to day 5 in order to be put back into your uterus as high quality embryos. Not all of them are going to grow to day 5. So I knew that there was a drop off at every point, and I needed to there's a calculator that sort of estimates based on those 3 things that I told you about, your AMH, FSH, and antral follicle count, how many eggs you need in order to get a certain number of, honestly, live babies. And so for me, 22 eggs, I had about a 90% chance of having 1 baby, a 70% chance of having, a 60 to 70% chance of having 2, and a 50% chance of or 40% chance of having 3. And that was because I had frozen them at 28. Now, I had my 4th egg retrieval was when I was 32. Those eggs are not as good quality as they are when I was 28. So the earlier you start freezing, the less cycles you have to go through to get a certain number of babies, and the less expensive it ends up being, because each cycle is a different. It usually costs more and more with it costs. You have to obviously add on. At Shady Grove, where I work, it's actually less and less every cycle, but obviously you have to continue to pay.
So it was really more about actually getting the right number of eggs that you needed to have the number of children you wanted. So
Exactly.
no matter, it just depends. Like, let's just say miraculously you had 30 eggs that were saved, you would only have to do this procedure really once.
Right.
But for you, it was like hitting that.
Yes.
That number.
Yeah.
So-
And younger women tend to produce more eggs with a stimulation, with a cycle. So if I was 25 doing this, I may have gotten 20 eggs on that first round. But because I started at 28, I only had like 10 eggs that first round.
Right.
And then I ended up having to do them more and more because I kept getting fewer and fewer eggs. So the earlier you start, the more eggs, the better you will respond to the medicine, and the fewer cycles you'll need to get the goal number of eggs that you want.
And then can you kind of walk us through the actual freezing process? Like what is, you already talked about the baseline evaluation, but what do you do next? Talk about the medications and the process of actually doing this.
Yeah. So basically, I had never injected, even though I'm a doctor, and we have to learn this stuff in medical school, but I never had injected myself with a needle. And I knew that it required me to inject myself with a needle. And I was really, really scared of that. I'm really bad at getting my blood drawn and stuff.
I'm the same way.
Yeah.
Vaccinations and things are.
Yeah. Not easy for us. Doctors are usually the worst patients. Anyway, so I was nervous about that. But I watched a lot of videos and I talked to all the nurses, and, I knew that if my patients could do this, I knew I could figure out how to do this. So basically, once you get all your blood tests and you decide you want to start with the egg freezing process, usually your period will come and you'll have all the medicines sent to you, like in the mail. Some of them will require to be refrigerated, some of them not. And then you'll start injecting, or you'll get a baseline ultrasound to see like how many eggs you have and like how low your estrogen is. And then what you do is you take hormones that your body naturally produces every month. But normally, remember how I said that you lose 20 to 30 eggs a day? They just die and get reabsorbed by your body. So what happens when you start having your first period is that first day that you start bleeding, one of the 20 eggs that you would have lost that day actually starts responding to a hormone that your body produces called follicle stimulating hormone. It stimulates the follicle to grow. So you have one follicle grow for the month, which has an egg inside of it. Every other follicle from that day, every other follicle from the rest of the month just dies. So what we do is we give your body that hormone, FSH, follicle stimulating hormone, at a much higher dose than your body naturally produces, so that we can recruit all 20 to 30 eggs that would have died that day on that one day that we start your stimulation. So you take the injection, you come in every other day for ultrasound and blood work. And what we're doing is we're monitoring your response to the medicine. So we hope that your follicles are growing in size. So we measure the size of the follicles. And we also measure the level of estrogen, and your estrogen should rise. And it usually takes about 10 to 14 days of injections in order for your estrogen to be a certain level and your follicles to be a certain size that you're ready for a special injection called a trigger injection, which is a different injection that you take to help mature the egg inside the follicle. And then 2 days later, you come in for what we call a retrieval. So basically you'll have, and by the way, when we're monitoring your response, if you are over responding to the medicine, we'll go down on your doses. If you are under responding, we'll go up on your doses. So we really titrate everything based on how you respond to the medicines.
It's really a personal thing.
Definitely.
So it's not like, here's your medicine, go for 2 weeks.
Yes.
It's like every day.
We're monitoring you. We're watching you, making sure that we're doing the right thing for you. And then once you're ready for your trigger, basically what happens is you have nothing to eat or drink the night before. Then you come into our fertility clinic, which is not a scary, and you come into our fertility clinic, you get in a gown, just like you normally do before surgery. And then they put an IV in. At our clinic, we use IV anesthesia. So you go to sleep, don't remember anything. And then you meet the anesthesiologist, and then you lay on a bed, put your legs up. We put your legs up and put an ultrasound probe in the vagina, just like we've been doing every other day, but has a tiny little needle at the end that goes into each of the big follicles. And that needle is hollow, and it's connected to suction tubing. And so we press the suction and the follicle collapse, and we see it collapse. And inside that tubing should be all the fluid from the follicle, including an egg from each of your follicles. We then take that fluid and we put it into a petri dish. And then we look at it under a microscope and we count the number of eggs that we see. And hopefully we get as many eggs as the follicles that we saw growing. So it's not a scary operating room that you go to normally with like big surgeries. It's a little operating room that's inside of our clinic. So
It's outpatient procedure.
outpatient.
Go home the same day.
Yes. Okay. Exactly.
Awesome. And so we've talked a lot about your, the eggs that you've frozen. You've done this 4 times, and you've talked a lot about the process. Are there any plans at this point to use your eggs, or like when are you thinking about using those now that you're 36?
Yeah. So I mean, I hope that I still meet the right person and can use my partner's sperm and fertilize the eggs with the sperm, create embryos, and then hopefully have good high quality embryos that I can put back inside of me to, get pregnant. Now, if I do meet the right guy before the age of like 40, 41, I will still give myself 3 to 6 months of having sex naturally to just see if I can get pregnant on my own.
Right.
Because it just, the definition of infertility is if you're between 35 and 40 and you've been trying for 6 months to get pregnant and haven't been able to conceive. So I still want to give myself that time. If I'm over 40, it's 3 months. So I'll still give myself that time. But if I don't get pregnant, then I'm immediately going to go to those young 28-year-old frozen eggs to fertilize them. And they'll probably do better because the older we are, the worse quality our eggs are as well. So a 39-year-old egg is not going to be as good as a 29-year-old egg.
Right.
That egg, so when an egg and a sperm get together and create an embryo, it starts to divide, and there are always errors that occur. But when you're 20s, you have really smart eggs, and so they're able to correct those errors and lead to a normal, healthy baby. But after the age of 35, your eggs are not as smart. So when errors occur, when the embryo is dividing, they can't correct those errors. So you end up with babies with chromosomal abnormalities like Down syndrome that usually end in miscarriage. So really the egg quality is a lot better for my 28-year-old eggs than, 40-year-old eggs that I would use.
And then, since you're not married at this point, what is it like when you're dating and you're talking about this to like potential partners? Are they intimidated by this conversation, or do you kind of tell them on your first date? What has been your experience?
Yeah, well, I'm a really blunt person, as you know, and I feel like if they don't like talking about this, and they're not going to like me, because this is like my life, this is my job,
Right.
But I have, it is true that men, tend to be like, they don't know much about this. So I really encourage you all to talk to your brothers, talk to your guy friends, talk to your husbands, talk to their friends, tell them about this so that it becomes more normal. So when you go on these dates, that they're not as weirded out. But that's what I'm doing. I mean, I'm telling everyone about it, and
I feel like it takes the pressure off a little bit.
It does.
It's like, oh, well, I'm not just looking for a sperm donor and a husband. I'm looking for, someone, we don't have to have that extra pressure.
Yeah, exactly. And I think it's also empowering for us because when we go on these dates, they might think, oh, she's 36, she's probably going to settle for me. But, yeah, but I feel like, no, we are not going to settle for you. We have our eggs frozen. So it empowers us as a group of women that, are career oriented or just haven't found the right guy yet. And so I feel like it's a really empowering thing to do. And the more that we talk about it and the more, I think that, the more normal it will be.
And along those lines, I feel like there's a stigma surrounding egg freezing, and a lot of women, even my friends, I try to also encourage them, especially the ones that aren't married now, this is something you should just consider doing. It's very easy. Why do you think the stigma exists? I know you see lots of women and talk about this all day long, but what do you think it is?
Yeah. I mean, I think it's a combination of a lot of things. Number one, it's just not being very common. So people don't know a lot about it. And whenever people don't know a lot about something, there becomes a stigma. Two, I think that, it's admitting to yourself and admitting to anyone that you tell that you may not have found the right person yet. And that there may not be, that person isn't right around the corner, and maybe he is, but maybe he's not. So it's really, ultimately it's actually taking control of that, and giving you a little insurance policy. But you do have to, admit that to yourself and take your own health and your own fertility into your own hands. And so I think that that's really hard to do.
Yeah.
But yeah, it doesn't mean you're giving up. It doesn't mean you're not going to try as hard as possible to meet the next guy. but it certainly takes off. Like I remember when I first froze my eggs, I had this huge relief after the doctor came and told me you have 12 eggs frozen. I was like, oh, I don't have to settle for these guys. Like
Yeah.
it was so weird.
Yeah. I mean, there's a lot of like, I mean, men don't experience the same thing from, you know, reproductive pressures that women have. And so I think that you're really highlighting like, you know, what goes on emotionally through our minds about fertility, especially career-oriented women. So
Yeah.
it can be extremely challenging.
Yeah,
So,
for sure. Okay, Jessica, let's start asking, let's flip.
Well, Valerie, we actually have a couple questions that have come in on the chat if we want to
for
we'll
sure.
move to the next segment. So I know you answered mainly the question about why you froze 4 times, but someone said, do most people have to freeze them more than once? They were
Good
wondering
question. Good question. Thank you for asking that. That's something I should have highlighted and I want to highlight. So yes, so if typically, you know, we say if you're between the ages of like 30 and 30, well, let's say under 35, you want to freeze 20 to 30 eggs. Over 35, you want to freeze like 30 to 40 eggs. It just depends on, you know, how many children you want and that, but just because we know that the egg quality and quantity declines with age, or that's how many eggs you really need. So typically you need 2 to 3 cycles to freeze that many eggs. Of course, we'll have the very lucky, you know, young, you know, 20-year-olds that come in that do amazing and get that many eggs on their first cycle. I hardly ever see that. Usually you need more than 1 cycle. So there's a lot of different, then you start thinking about financial packages and how much that costs and all that stuff. And so we can talk a little bit about that later on, but usually you need more than 1 cycle to get to your number of eggs. I mean, I needed 4. Most people I see need anywhere between 3 and 4.
Okay. On that, someone said, are there any stats to show how effective frozen eggs are in resulting in a baby? How safe of a backup plan is egg freezing?
So, you know, there's always the chance that you can get 0 babies from 30 eggs frozen. For me, I know that statistic with 22, let's just pretend that they're all 28-year-old eggs frozen. There's an 8% chance I'll have 0 babies from that. I have to accept that, you know, but there's also a 0% chance. There's a much higher chance that I'll have 0 babies if I have no eggs frozen. So, so for me, it was very easy, you know, to take that risk. But yeah, it's a good insurance. It's the best insurance policy that we have. It's not 100%, but it's the best one we have. Now, I think that it's really important that we get to Jessica.
There's one really great question. Can you still get fertility testing even if you have like an IUD?
Yes, absolutely.
So that's a really good question.
Yeah, so good question. I did the whole process with an IUD in, okay? Because the IUD is local hormones. It doesn't affect your testing. If you are on chronic birth control pills, that can falsely lower some of your values and make them look a little bit worse. But we know that, and the doctors that educate you on your numbers will tell you that. It doesn't significantly lower it, but it may falsely lower it a little bit. You could get off of, if it's very low, you could be like, I got to get off birth control pills and see what I really am after like 2 or 3 months off of the pills. But if it's very, very, very low and you're on birth control pills, I mean, I would definitely consider freezing your eggs. Now you would have to get off the birth control pills in order to do the stimulation, but it's only a couple of weeks. But yeah, so good question. Okay, now I'm going to ask Jessica some. But
we'll move on to Jessica.
And I hope to get to all of the questions. Okay.
I know, we'll get to.
Okay. All right. So Jessica, can you now I shared a lot of my story and about, you know, what brought me to egg freezing. It's very different than yours. And I really want to know about what led you to freezing, you know, going through fertility treatment and freezing stuff.
Yeah, no, I mean, I think that as, you know, a very type A personality and very career motivated, it is definitely something that like came into my head, but I always was like, I mean, I've been dating my fiance for like 10 years now. And I was like, oh, we're going to get married. And if like my planning would have, you know, played out as, you know, it didn't, you know, we would have been trying to have kids like this past year. And so I thought like, oh, you know, there's no reason for me to do this. But in hindsight, I honestly wish I really would have, because it would have been one less thing I had to do when I got diagnosed with breast cancer. So for me, The conversation came up when I was talking to my oncologist, and like I said, she was asking me about my family planning and my fertility plans. And since I was 34, and I think most people are having kids before then, even within our friend groups and stuff, I was like, well, probably in the future, I want to have kids. And so she just immediately recommended that I go and see the Emory reproductive endocrinologist. And so that's when I had a discussion with them about, with my fiance. Actually, he was in fellowship. So we didn't have a lot of time to actually come to these appointments, but he did come to like the initial appointment with me, just so we could find out more information. And after hearing from them, they really, encouraged me to just go ahead and either freeze my eggs or my embryos. And then I had a discussion with my fiance about, which one should we do? We didn't have a lot of time. So, for me, it became an emergency when it could have been something that I could have done like 5 years earlier, and I would have had these eggs and it wouldn't have been such an emergency situation. So I think, I have 3 embryos now, and I think that's a fine outcome, but
That's great.
I could have had more eggs and, more chances to actually have a better outcome with the egg freezing procedure. So I think that it's just being proactive, like you're saying. And so that's kind of how I got started. And that's how I got, introduced to this whole idea about, fertility preservation and oncofertility.
Mm-hmm.
So,
Yeah. I mean, I think that just so y'all know, it's true that when you there's a lot of things that can affect your ability to have good, high quality eggs. Number one, that she's referring to as chemotherapy. So chemotherapy can adversely affect your eggs. So just one dose of chemotherapy can make you infertile forever. And it depends on the type of chemo, and it depends on what age you get the chemo, and it depends on the level of chemo that you get. And so oncologists, cancer doctors try to make their best guess as to what the effect of the chemotherapy that this patient is about to receive, how it will affect their sperm or their eggs, because it can also affect men. But you never really know. So sometimes people gain their fertility back completely after their chemo, and sometimes they don't. So it's really amazing when a cancer doctor takes the time to actually talk to their patients about fertility, because they're so concerned about the cancer, obviously, that it's hard to think about anything else. So
I think she was like, definitely, she was a young woman herself. And so I think she could sympathize with me a little bit, and also was like, I think it's safe for you to do this. Not all cancers will allow you and young women to actually go through the procedure. So I feel very lucky and thankful. But I think it's definitely something to just pause and think about, and especially ask your oncologist about if you get diagnosed with cancer, because you don't know the effects of these really toxic medications.
Yeah, yeah, for sure.
Yeah.
So why, just go back a little bit and tell us a little bit about why you decided to freeze embryos rather than eggs, and kind of what the difference is.
Yeah. So, she had kind of sat down, went through a whole drawing about what the difference is. And I'm going to maybe ask you a couple questions about it, because technically, but for us, I think it's a personal decision. We were engaged. I think we had been together for so long, and, I thought we were going to get married. I think, I don't always recommend that. I think if you get diagnosed with cancer, it changes you. It also changes your relationship. So I think you just have to it's really a personal decision. We had a conversation in the office, and we were like, should we do eggs or embryos? And I think when you're diagnosed with cancer, you're overwhelmed with lots of decisions. So we just decided at that time, just let's freeze embryos. We were told by the oncologist as well that, they can survive better if you freeze embryos versus eggs. And maybe scientifically you can kind of
Absolutely
tell us why. And so I think, coupled with the, us being together for so long, and then knowing that they're going to survive better, and that we were only going to do one round. So you got to do 4. I only had the opportunity to do 1. So we were like, let's just give it our best shot.
Yeah,
so,
for sure.
Yeah.
And that is true. So eggs are the biggest cells in our entire body. They're made up mostly of water. And what happens when you freeze water? It becomes ice. So when you freeze eggs, there are ice crystals that form. So it makes it really hard to thaw them well. The technology's improved a ton, and we can now freeze them very well. But the embryos are not, they're not as large as eggs. They don't have as much water, and they're much more resistant to the thaw process than eggs are. So all the numbers that I quoted you on freezing eggs and how many eggs you need to make a certain number of babies, that number drops by 5 to 6 eggs per baby that you want if you have embryos frozen, because they just do so much better. So having 3 good quality embryos probably would come from, 15 to 20 eggs frozen. So you did really, that's really good what you did.
And I guess, for, your patients that are married, they're probably coming in and freezing embryos and not freezing eggs, right? So,
Yeah.
so that would be another reason in a time that you would freeze embryo versus eggs. I think it's eggs maybe more when you're younger and you haven't identified a partner.
Yeah.
So.
Yeah. I mean, egg freezing for me, I would do that at this age too. My patients that come to me that are ready to have that want to have multiple children, but we can only transfer 1 embryo at a time. So then we'll freeze the rest of their embryos so that when they're, they're 34, I put an embryo in them and they can have a baby. And then when they're 36, ready for their next baby, they have a 34-year-old embryo waiting for them that I can put inside. Yeah. Okay. So, can you now tell us something that's really, really important? And I think everyone should really listen to this, is how you found out that you had breast cancer.
Yeah. I think, it's a short story, but really I had experienced a sharp pain along my right breast, and I immediately kind of moved my hand in that area and I felt a lump. And honestly, I wasn't sure if it was in my lymph node, which is the area under your armpit, or if it was actually breast tissue, but I knew it was new, it was abnormal, it was really small. So I could have ignored it, but I didn't. I actually went to my primary care doctor and I had her examine it just the next week. And so she looked at it, she examined my breast and was like, oh, there's a lump here. It's small, it's probably nothing, but she was young and she also had mammograms and biopsies before. And so she was like, I think it's important that you actually get this evaluated. And I was like, sure, let's do that. So I went to,
and so I know you've said this, so you had just a little bit of pain.
It was a few small amount of pain. It was like seconds. And I was like, oh, like, why am I having pain here?
And then you had a pea-sized nodule and you took action.
Like a pea size.
Like, that's amazing.
So small. So I think it's so easy for women, especially young women, to ignore these things. And so I didn't. I was like, let me just check this out. And I was so worried about the number of appointments that this was going to take. I was like, okay, I have to see my PCP. I have to see my, I have to now go get a mammogram. And then they were like, you need a biopsy. So, in hindsight, that was silly. But so after that, I had the mammogram and I had an ultrasound. And if you're younger, they're going to do an ultrasound on your breast because the mammogram won't be able to capture all of the lumps and bumps that you may have accurately. So they did that. They recommended a biopsy. Again, I'm thinking nothing of it. I'm like, okay, 2 weeks later, let me go get my biopsy. So I do the biopsy, and a week later I was traveling and I was actually in the airport in Chicago, and they call me and they tell me I have breast cancer. I was in utter shock. It was shocking. I didn't have a family history. I was very active. I was doing so many different things. So to hear this, I was just shocked. But honestly, there's, I think, gifts in the unexpected. And so I think that's how I found it. And I think the lessons that I learned and that I tell like most women now is that 1 is to do self-breast exams. 2 is, you have to advocate for your own health and really know and listen to your body. If I wouldn't have put my hand there, I would have never have known that there was a lump because I wasn't doing self-breast exams. And I would have, it would have taken longer for me to diagnose this, and I could have had, a different outcome, which would have been unfortunate. So,
Yeah.
Yeah.
So, okay. So you went to your the doctor said that you had breast cancer, and then he gave you the option of fertility preservation, which you did, and you got the embryos. And then what happened like the day after you finished, your fertility preservation?
Yeah. So I did the same process that you did, except there was like a lot less pain. It was like, I saw the fertility doctor. The next day I'm, driving to the specialty pharmacy, picking up these medications and just injecting myself, getting ultrasounds. And we did this, within 2 weeks, just like you said. And the same thing, injections, ultrasounds, blood work. And then I went into the Emory suite and they did the procedure, and it was the easiest of all things that I did during that time. I had the egg retrieval procedure on a Thursday, and the next day I started chemo. So my doctor was like, once you finish, we're going to start chemo immediately. So I then went on and did 5 months of chemo, which was extremely taxing. And then I had surgery a month after that, and then reconstruction surgery. So it was a lot.
What was your chemo like?
The chemo was probably the worst of all things that I did. It was 5 months. It was extremely intense. I think when you go from not feeling sick and not being sick to chemically being sick because of the medications, it is extremely depressing. You're very, very tired. You don't like food, which was weird because I love food. But I hated it. I was like, I don't want to eat. And so you lose your identity. Honestly, I lost my identity. I did nothing. The things that I had done, on July 27th, the day before I was diagnosed, were completely different, the day after. So it definitely changes you. And it was, an eye-opening experience. And, I think I've learned that our bodies are so resilient and that time passes with all of this. So, no matter what you're going through, those are, things to always keep in mind.
Yeah.
So, but it was tough. It was very, very tough.
Well,
But I was really happy I had those embryos.
No. I mean, I'm really happy that you did well. And you're now in remission or
Yeah. So I did the chemo, I did surgery, and I had a really good response to the chemotherapy. So, I'm moving on back to normal life. So, whatever normal life is.
Yes. I know now we've all lost our identity because of COVID.
Yeah.
But speaking as someone that knew you in high school, and I'm sure everyone on this chat, if you know Jessica Shantha, her identity is like the sweetest girl in our class.
Thanks,
and we still are, and we love you. And I know we all feel like we've lost our identity, but okay. So I mean, what do you think that you want to, I mean, as far as like understanding your body, because I still can't wrap my head around the fact that, like, imagine having a very short, like a couple of seconds long pain in your side and feeling like a pea-sized thing. Like, I feel like I see pea-sized things on my face all the time. And like, I have no idea it's something I should like.
Yeah. I mean, I think that like the most important thing I would take away from just the fertility talk and then just the breast cancer is that you have to be proactive, right? So I think, and that's why I advocate for women to do self-breast exams, even though the, OBGYN boards and stuff don't advocate for that. And I think it's because our medical system, healthcare system is very reactive or not proactive. And same with women about their own health. So, I think the biggest take home point is really knowing your body. So that's why I say do a self-breast exam. So when you realize that there's a lump, oh, this is abnormal. This is really abnormal. This wasn't there last month, right? And then you can go to your medical professional, your doctor, your OBGYN and say, hey, this is new. I'm concerned. On the flip side, if you don't know and you're like, I have a lump, and then you kind of waltz into the doctor's office and you're like, I don't know. Like, I think that this is new. I'm not sure. They're going to be like, oh, okay, let's watch it. Right.
Right.
Well, we don't want to watch it. We want to figure out what's going on.
Right.
So I think it just makes you more of an advocate for your own self and for your own health. Right. So if you can advocate for yourself, if you can be proactive, I think it's going to help you. Right. And so I think that those are my take home points for today.
Absolutely. Absolutely. I mean, also, I think it's important, and I don't know if you have this, but like young women often have breast tissue that is irregular.
Right.
It's like normal, and sometimes it will even change with your period. So and you keep describing it as a lump, but it was just pea size. So
it was like a pea.
So just know if you have any like peas in your breast.
Yeah. Yeah. I mean, I think that's just like the most important thing. And it goes for your entire body. Like, we're talking about our breasts, we're talking about reproductive, organs. I mean, it's your entire body. Right? So, so Valerie, just to like kind of round out this discussion, we haven't really talked about how much this costs and what that kind of looks like. So what is something like this in terms of cost? And, I know how much it costs for me. There's also grants for people who are undergoing chemotherapy, but for just a regular person walking into your clinic, what is possible?
Yeah. So I definitely recommend that you, search around the fertility clinics in your area. And, you can do online searches. You can actually have consultations with the doctors, or you can have consultations with the financial counselor sometimes before you even see a doctor, just to know what their prices are and make sure that, every big fertility clinic has egg freezing, and every big fertility clinic is going to have pretty good outcomes. They all have similar outcomes. The most important thing, I think, is making it financially affordable, and being with the doctor that you feel comfortable. So I can really only speak to my clinic, but I know that since I did this 4 times myself, when I decided what practice to choose to work with, I wanted a place that increased access to care. And one of the biggest barriers to IVF and egg freezing and all that is cost. So I knew that I was really passionate about that. And where I work at Shady Grove Fertility, I know that I'm super biased by saying this, but it's true. It is the prices are really good. And so, for example, for the first round of egg freezing, it's $7,500, and for the second round, it drops down $5,000 each cycle. Now, we also, that's if you don't qualify for my favorite packages that if you would qualify for, if you actually got into this at, a reasonable time. So I mean, some women would qualify for it at their late 30s and some women don't qualify for it in their late 30s, but basically it's called the Assure program. So we assure you 20 eggs or assure you 30 eggs and an unlimited cycle until you get to that number of eggs, which is so cool. And you pay a flat fee. So that fee is $10,500 for the Assure 20, and the Assure 30 is slightly more. So basically the coolest thing is that it's called shared risk. So you are pooling the risk with the young girls that enter this program and only need one round of IVF to get to 20 versus the older women that need multiple rounds and end up saving a lot more money. Mm-hmm. So it's a really cool package, and it's called the Assure program. And if you qualify for it, you have to have a good AMH, FSH, and good antral follicle count. Then it's an amazing package. So
and then, since you did this 4 times and you were obviously moving around through training in different states, did you do this at the same clinic or did you go to multiple clinics? Or
since I was traveling, I did. I went to multiple clinics. Okay. So, 2. I went to the clinic that I used in my residency in Texas, and then when I was in fellowship, mm-hmm. I did it twice there too. So, obviously, you want to go somewhere local, ideally. Just because you'll be going in, and like I've mentioned, to you before, no time is a good time to freeze your eggs because you're always going to be traveling. You're going to want to go out abroad. You're going to want to take some vacation. You're going to want to go to your sister's wedding or whatever. It's never going to be a good time to have 2 weeks to commit to this. You're always going to want to go on dates in the evening at 7 p.m. when you're injecting yourself and take a minute to go inject yourself in the bathroom. And sometimes when you're traveling, you have to carry your medicines in a cooler, and it's and I definitely left my medicines in an Airbnb in Charleston once, but anyways, it's never a good time, but right. The best time is now because your eggs are young. So, and also COVID makes it a really good time because we're really not traveling very much and doing anything. So
and to that point, so you've obviously frozen your eggs at different time points in your life. What would you say is the most ideal time, just in general for women? If you could give an age range, I'm 34, so I did it kind of late, way later than I think people would want to do it. So what is an ideal age?
I think 34 is not a bad age at all. I mean, I would say the average age that people come in to freeze their eggs is about 34. But that doesn't mean that that's a better age than 28. It definitely would be better if you started, in your 20s, but most women aren't ready for that. And they really think that they're going to meet their husband tomorrow. Like I always did and still do. So I think, so I really think that, the earlier the better. Again, I definitely think if there's any question in your mind, just go get evaluated, just go see where you're at and have a talk with someone that's educated that can tell you about those numbers.
In terms of the evaluation, would you recommend, going to your OBGYN or seeing someone who's subspecialized like you? And I know you mentioned earlier, it's an ultrasound and blood test, but is that something that's better interpreted by a reproductive?
I mean, OBGYNs can do this, right? Absolutely. And you can definitely ask them to do this and interpret it. If you have any question, you can take it to a fertility doctor. However, I've had many instances where patients come to me and they thought that their OBGYN said that everything was okay, and they come to me 2 years later and they have no eggs left. So I personally think that if you really want to be thorough and get the right opinion, going to a fertility specialist who's been trained for many years on this specifically and interpreting these results is the most, it seems like the best thing to do. So that's what I would recommend. But, and you don't need a referral to see a fertility specialist. You just call and make an appointment.
Yeah. I think we have about 10 minutes left. So Caroline, I don't know if there's any specific questions or if anyone has any questions for either Valerie or myself. We are more than happy to answer them. And I want to thank everyone again for tuning in. and for Caroline for
Yes.
allowing us to speak today.
Oh my gosh, thank you guys. This has been really,
Thank you.
really fascinating. And there have been a lot of great questions in the chat and a couple that came out in registration. So we'll try to cover those. So kind of back to the cost, everyone was really interested in the cost. Are there also maintenance fees to store the eggs over time, like you would bank cord blood, et cetera?
Yeah, there is actually. I got a bill like last week. So there is a maintenance fee. I think it depends. I actually don't know what it depends on, but I think it's wherever you bank the eggs.
Yes,
you
it
have to
depends on the
pay.
clinic. And on average, it's about $500 a year to keep your eggs frozen. And usually that cost is covered your first year. And
Mine
you can,
was $500.
Yeah,
$520.
it's $50 a month typically, I think, which I think is like 500.
Yeah.
600. Okay. Anyways, so yeah, and more, so the numbers that I quoted you, I just want to go back to, I'm pulling up, I don't want to give you incorrect numbers, but I know for sure that those numbers are specifically for my clinic, and definitely you should search around different ways. I saw someone ask a question of how to choose a fertility clinic. You can search on, on the internet. There's like large fertility clinics in the United States. You definitely want to go for a large one that has like a lot of volume, that's done this before. Those are honestly the most reputable one. Going to like boutique clinics, that's like not actually a good idea in fertility. Okay. So if you're a really good, well-trained doctor, you want to go to a large one. So go to a large clinic. Okay. One that's done many cycles. And then you can look up the statistics of each clinic on two different websites, Fertility IQ and SART.com. Those are different websites that can tell you like patient experiences from Fertility IQ, and SART.com can tell you like actual outcomes. Now, those are very hard to interpret from like a layman. I can hardly interpret them. So just shop around. All the big fertility clinics are good. Our outcomes are all really good, especially in Atlanta. So really go with whatever clinic you're more comfortable with, and shop the prices. I mean, honestly, just that it's going to really come down to what you can afford, and are your parents willing to help you if you need that,
The other thing is so
yeah,
like let's just say I move to Texas. Like, how do I get my eggs if I need them?
Yeah. So like my eggs are still in Texas and Ohio. So I'm going to need them shipped to me super easy. We ship embryos, eggs, sperm all the time, all over the country. So it's very easy. If you do it at a reputable clinic, they know how to freeze it, how to store it, how to package it, and how to ship it. And just to quote you the actual numbers. Okay. I was wrong. And I just want to make sure, because I'm not the financial person, so I don't always quote numbers. But the Assure 20 program is $12,500, and the Assure 30 is $18,000. Now that gives you unlimited cycles until you get to 20 eggs or 30 eggs. So just so you know, that's the number. And the price of just one cycle, if you don't qualify for that, is in fact $7,500. But every clinic is different. So definitely look at all the different clinics. I promise you ours are the least expensive, but definitely look around to find for yourself.
I don't actually remember. I did mine at Emory, and I don't actually remember the break. I was just getting so many different bills, so I'm not sure if it was fertility or.
Yeah, and if you do have, if you do get diagnosed with cancer, going to a clinic that is closely affiliated with an academic institution like Emory is a really good idea. Yeah. And there are always grants for cancer patients.
I think that's super important. Yeah, there's a number of grants that I applied to when I was going through this,
and they usually cover a lot. So
and
that's awesome. Are there any instances where insurance would cover egg freezing, or is it strictly elective and the grants are the best option to try to absolve some of that cost?
Insurance, actually I think Woodward might have some coverage of some of the fertility treatments. Insurance only paid for some of my stuff, but I have a specific Aetna insurance at Emory. I don't think it's standard, and I think it just depends on where you work, and I guess you would know more in terms of, do most of your patients
a lot of patients use insurance for IVF when they have a partner or when they're going to use donor sperm and they're freezing embryos. But insurance does not typically cover egg freezing, unfortunately, yet. We are working on that. And if you work in the insurance field or work for a big company, then you should definitely promote that in your company, because we're trying to work on that. There are probably a few insurances, like maybe if you work for Google or Facebook, they might cover egg freezing. I know that they were the first to cover IVF, so they might start covering egg freezing. but yeah, so most of it's not covered. Egg freezing is not covered by insurance, but IVF is, which is so annoying. And hopefully we can all advocate to get that changed. But at this point, it's really not. So tapping into your family can help. I did, taking out a loan. I mean, to be honest, like, I think it's worth it. It's a really big investment, but it's for your future and your children.
And then what do you do with those eggs? There's a question here about if you don't use them. So what happens to them?
Yeah.
I think I signed a consent form, which I think I donated them to Science or something.
Oh, great.
But I don't
Yeah.
know, like, what is,
yeah, I mean, so if I, am 55 and never going to use the eggs, I mean, I can keep storing them and paying $500-600 a year in case my daughter needs them or something, God forbid. Or I can discard them, or I can donate them to science. So there are different options.
And is there like a shelf life for eggs? Like after 20 years, are you like, I don't know.
So far, no one's had, we've used frozen eggs like that are 20 years old. I think that might be around the oldest. And they've had fine outcomes. So really that you can freeze them for as long as you need. And now with the technology that we have to freeze eggs, the frozen eggs now are going to be way better than the frozen eggs from 20 years ago. So
this is a really great question. Do the hormone injections increase your risk of developing diseases like breast cancer?
Good question. So definitely we're giving you hormones. So if you have a history of hormone responsive cancer, we would definitely choose your medication so that your hormone levels remain as low as we can keep them throughout the process. Luckily, I know Jessica had hormone negative cancer, so they were less concerned.
Negative, so that's actually, I think, why they let me do the fertility treatments, and they actually like maxed me out on dosing of medications because my cancer did not respond.
There are some cancers that respond and grow in response to hormones, and that is something that they know on the diagnosis of the cancer. And in those cases, we actually still will let people undergo IVF. We will just make sure we keep their hormones as low as possible. And regardless, in general, in the past, IVF, some people have thought may increase your risk of cancers, but the recent studies have shown that it doesn't increase your risk of any of the cancers. It may increase borderline ovarian tumors, but that data is very minimal. And so far the studies have shown that it doesn't. So I've done it 4 times, and
another great question is, do you have to go back to the clinic where you froze your eggs? Like, let's say, they found you and they wanted you to do their procedure. Can you transfer your eggs to a different clinic, or is that?
Yeah, you definitely can. You can use your eggs wherever you want. So I would just transfer them to, whatever has, wherever you're located, I would recommend.
And we had another question on registration, and I thought, what is the downtime like? Like, I know you said it was outpatient, but are you going to need a day off work to recover afterwards? What's that look like?
Yeah, I needed a day off just because they give you anesthesia. So I think I get sick with the anesthesia. So I had to take like a day off, and I was starting chemo the next day. But anyways, it's usually like a day off. I also wanted to mention, I think someone else talked about like the actual procedure of going in to get the ultrasounds and doing the lab work. They are super they are flexible with your schedule. So they have appointments at like 7 a.m. So you can go in before you go to work, or they have late appointments. And it doesn't matter if it's a weekend either. It's, they are open on the weekends. It was actually like the best thing. They schedule you. So they're really flexible with your work schedules. And I'm sure, where you work now, you can kind of tell us more about that. But
like where I work now, I mean, I see patients virtually, and then they go in for ultrasounds and blood work. And it's true. I mean, I see patients in the evening because I know that women work, especially women that are egg freezing, and that's my passion. So, we work around your schedules. And then as far as egg retrieval goes, I did something very irresponsible that I wouldn't recommend for any of my patients or for y'all. But I was a resident at the time, and I had to go to work that night to like deliver babies and stuff. So I still went to work. I just told them I couldn't actually deliver any babies until after midnight when it was the next day. But you have had anesthesia that day, so you shouldn't drive or make important decisions that day. The pain is so minimal after. I mean, I had cramping. Some women have more pain than others.
I had like no pain. It was like I didn't even.
Okay. Yeah, it was like the most mild period cramp for like a second.
Yeah.
you just go home, drink milkshakes, watch, you know, Bravo, and
Take a
relax.
nap, and then that's, you know.
Yeah. And you have this huge relief off your shoulder that you don't have to settle for the next guy. And then tomorrow you're back to work. I mean, you can do whatever, no restrictions. So your ovaries do get large as you're stimulating yourself with hormones. So there's a risk of what we call ovarian torsion. So we recommend no heavy exercise for the week before and the week after your retrieval, and then no sex, because number one, if you ovulate early, you could have like quadruplets. And number two, just having sex itself can cause you to torse your ovary. So those two things are, you know, other things.
It's basically 8 o'clock, but this is a really good question. Freezing your eggs make it harder to have kids the old fashioned way later? So like if you did this, like for you, is it going to be harder to have regular kids?
Good. Thank you for asking that. So I get this question all the time, and I tried to highlight it earlier, but I'm definitely going to reiterate the fact that absolutely not. So we have 20 to 30 eggs we lose every day, no matter what. All we're doing is recruiting those eggs that would have died that day. Does not impact your future fertility in any way, shape, or form. It does not affect your next period. You just recruit eggs that would have died on its own. So good questions.
So just hijacking the natural process.
Yes.
Let's see. Caroline, are there any other questions that you think are important to highlight before this ends?
Well, we definitely want to be respectful of y'all's time. I know people could probably ask you guys questions all night, but I guess y'all's major, just, you know, closing statements that you want people to take away from tonight.
Yeah, I'll start. I just want to say thank you to Jessica for sharing her story. I think this may be one of the first times that she shared it, and she shared it with her Woodward family, which I think is so special. And we're so thankful that, you know, you did great. And I think that when I heard your story, I could tell your passion for, you know, for understanding your body, and I'm so happy that you did take that initiative, and that you have the strength to share your story with all of us today. And you're so special.
Thank you.
And thank you, Caroline and Woodward and everyone. But I do feel on a similar tone, that, you know, take responsibility for your health and your fertility. Admit, you know, just go get evaluated. And, you know, if you have any questions for me or for Jessica, you can find us like on Instagram, or you can email. Caroline can give you guys our email.
Absolutely.
And if you follow me, Valerie Libby MD. And you can make an appointment with me. I can also talk about the other clinics in Atlanta are great too, the big clinics in Atlanta. So if you have any questions, feel free to ask me. And I do see patients, you know, in Atlanta and actually out of state as well. So
yeah. And just to echo Valerie's thoughts, I think it's, you know, for me, knowing your body, like listening to your body, knowing it, listening to it, and then also advocating for yourself. So advocating for your own health. So yeah, on that note, I think, you know, thank you guys again for joining, and thank you, Val, for your expertise in this area. It's kind of amazing. Yeah, thank you, Caroline.
Yes, thank you guys so much. This was really, I learned so much. And Valerie, thanks for sharing your expertise and experience, and Jessica, your story. We are so just happy that you did take action, like Valerie said, and for sharing your experience, so that, you know, going forward, it could impact someone else's decisions. So thank you guys so much. Loved seeing you.
Thank you guys.
Thank you,
everyone, for joining.
Bye.